Welcome back to the morning show here on the Rise News. I'm Adesua Omoron.
I'm Rafai Yoseni.
And I'm Shaiton Atigari. Good morning.
What a pleasant day having you great women here with me. Lagos State, known for taking the lead in the advancement of health initiatives, is a huge center of excellence in health matters in Nigeria.
Indeed, you can say that again. And to buttress this, well, the state recently launched a Smart Health Initiative. It has been called a laudable project, and it will enable health facilities within the state to run its healthcare system with the support of electronic processes and technologies.
The initiative shows how important the state government upholds health and well-being of its citizens, especially as it relates to current trends in health management's information system.
So joining us to shed more light on this and other health issues in Lagos State is the Commissioner for Health, Lagos State, Prof Akin Abayomi. It's a joy having you here. Thank you so much for coming around, sir. Let's start with the health sector in Lagos State. I mean, you assumed office about, what was 8 months ago, 7, 8 months ago?
4 months.
4 months ago. We get correctly. Accelerating the process.
I'm trying
4 months ago.
To slow time down.
Okay. 4 months ago. What has been the situation of health in Lagos? I mean, I know there are periods of issues we talked about, but let's have a general overview.
Well, thank you very much for having me on the show. It's a pleasure to be in your facility here. I think really we've come to a point where we've recognized that health can't be business as usual. So we've been trying to do the same thing for several administrations, and I think there are several peculiar circumstances in Lagos, the famous megacity of Lagos, that are mounting on us, so we've got to start thinking outside the box. So we've decided to look at health in several new dimensions. A very high-level political view of health. We start to think about, how do we define the role of government? What is the role of government in providing healthcare in Lagos? In fact, what is government? So government is federal, it's state, and it's local government. And I think up till now, we haven't really defined the roles and responsibilities of those 3 tiers of government as it relates to the health sector. Then we look at the economic indices. What, for example, is the budget of Lagos State? We know it's just over 1 trillion naira this year, announced by Mr. Governor. And then you look at the GDP of Lagos. Lagos is supposed to have one of the top 10 GDPs in Africa. If you try and quantify the GDP of Lagos, it's over and above 30 trillion naira. So you look at the state budget and you look at the GDP, and there's a massive incongruence there. So it begs to think, what is exactly the role of the state government in providing health for the citizens of Lagos? And I think we've started to think of our role in slightly differently. Rather than being service providers, I think we should move our attention to being strategists, policymakers, regulators, and providing an environment for the health sector to boom in Lagos as part of the bioeconomy and the knowledge economy, which was one of the things we talked about during the Smart Health Initiative that we just launched in Lagos. So that's a very high-level view, of what our role as government should be, So we also need to establish what is the benchmark, So we have 27 general hospitals. We have about 330 primary healthcare centers, and we have 1 tertiary academic unit, the LASUTH. So when you look at all the health infrastructures in Lagos, there are over 3,000. So we're now talking about an average of 400 public facilities compared to 3,000. So it begins to show, similar to the state budget and the GDP, that the services provided in the state are in a large form provided by the private sector. So it's important for us as government to be able to set the standard.
Let's talk about the shift
Yes.
You know, the Smart Health Information Platform. Now, one of the objectives of this is to connect, like you said, the primary, secondary, and tertiary facilities and leverage on the technology that we currently have and even get more to make sure that healthcare goes round evenly. Now, my question to you is, how do we begin to bridge that gap? Because technology as it stands on its own in Nigeria, in Lagos, is still seen as something that hasn't gone round among the people. So I want to know, how do you plan on bridging this gap with the SHIP initiative?
Okay, so we're trying to get more health for our money. So when we're operating within a restricted resource environment, you know, we have to start putting efficiencies in place. So technology helps us to do that. So if you've got limited amount of money to provide a certain amount of resource, then you want to block leakages and you want to make sure that that resource is used to maximize the impact. So in trying to connect the 3 tiers of health from primary, secondary to tertiary, you can imagine a patient is being referred from a primary to a secondary and then to a tertiary because of a series of complications. What would happen now is the patient would be sent from a primary to a secondary. There are no accompanying documents that give a profile of that patient, so the receiving doctor has to wait, you know, for maybe a lengthy file or a lengthy referral letter. There's a breakdown in the historical connection between why they're in the new facility from the primary facility. So if we had a digital network, then that would be automatic. The doctor would just click into the system and see the historical profile of the patient. Similarly, we'd be able to keep a more accurate inventory of our stocks, of who is doing what. We will be able to bill more appropriately. You know, we will be closing the gap on opportunities for wastage and for misalignment of the resources that we have in health. So I think your question was bordering on, is Lagos ready for this kind of technological advance? And I think, you know, when we look back at internet banking, you know, people were a little bit skeptical about it, you know, and that wasn't too long ago. I can remember it's about 10 years ago, people saying, how are we going to do this? But now even our mothers in the markets are transferring, you know, e-cash. You know, so I think that's the trend. We shouldn't be afraid of it. Everybody's more or less got access to a digital device, you know, and we've got a whole Lagos Silicon Valley sitting in Yaba. Most of them are really underutilized. So this is a great opportunity to create employment for our youth and to create the opportunity to expand their minds and apply their minds to the health sector.
Well, it's a whole conversation that the Smart Health Initiative has thrown up, but I would like to talk about other health matters in Lagos first and come back to that. Providing affordable and accessible healthcare for the millions of Lagosians is Herculean, and one can only imagine how much that is in terms of costs. And I'd like to ask you about the Lagos Health Insurance Scheme, because that was an initiative to also bridge that gap and help Lagosians stop out-of-pocket payment, you know, the underserved Lagosians, the indigenous poor. How far has that scheme gone?
Okay, so when you are accessing health, you have to pay for it. Health is not free. Someone pays for health. So you either pay out of your pocket, or if you are living in an egalitarian system, a social system, the state pays for you. The state will pay for you if you have a very effective tax system in your country, like in Europe. Certain Scandinavian countries will pay up to 40% of their income, if not more, on tax. And then the state can afford to provide these services free of charge, you know, for everybody, from the wealthiest to the most underprivileged. And then the third option is some kind of social insurance scheme, where everybody makes a contribution. That contribution goes into a pot. If 100 people make a contribution, not necessarily 100 people will present for health. So let's say 10 out of 100 present for health. Then the income that's paid from the remaining 90 goes to subsidize for the 10 that actually present for health. So we went through an elaborate process of trying to work out what that premium would be, considering the income base of the majority of Lagosians. And we found that probably the most appropriate tariff would be about 40,000 naira per family of 6 per year. If you break that down into individuals, it comes to just over 8,000 naira per person per year. If you break that down into a month per person, it's about 700 naira. And you could walk into any of our facilities and get a basket of health services, that we've defined: blood pressure, diabetes, pregnancy, immunization, those kinds of things, which is the majority of what our citizens need. As it turns out, we have a number of constraints. First of all, we've discovered through our Lagos Bureau of Statistics that a lot of Lagosians can't even afford that very basic premium. So that's a challenge. The second challenge is that our infrastructures at the moment are not particularly conducive to building the confidence that you can go out there and say, please buy this product. If you buy this product, you can go to our facilities and get universal health coverage. So these are the challenges we're facing to first of all, put a lot of effort into revamping the public facilities and then regulating the private sector that want to join the scheme to make sure that we're sitting at a standard that is internationally recognized and that builds confidence in Lagosians to actually buy this product. And then to work out a way of Lagosians being actually able to pay for this product. If 60–70% of Lagosians will struggle with that very basic premium, then we have to start thinking out of the box,
Okay. I'd like to talk about something that is quite very dear to me before we go on a break. And just to alert you, Honorable Commissioner, we're going on a break soon, a couple of minutes from now. I'd like to talk about health for people living with disability in Lagos State. That's an issue very dear to me. A couple of years back, I was some think tank, put together by the then special advisor to the governor. That's the last governor of Lagos State on disability. And, we advanced the conversation, and I gave some, very good input as regards. So I want to know what has happened now. You want to narrow it down to children living with disability, children with Down syndrome, children with, so some other ailment, autism spectrum and things like that across board in the state, because that is quite very dear to me. A lot of those people feel left behind.
Yes, when you're dealing with so many problems, you always have to put things into perspective. We really got challenges with, the most basic delivery of care in Lagos for standard things. But that doesn't deviate from the fact that we must look after the needs of all Lagosians and people living with handicap, the whole spectrum of handicap from physical to sensory to mental. These are all the issues that we're trying to now build into our planning and our strategic vision for the future of health in Lagos. So for example, in our new concept of developing standard designs that Mr. Governor has mandated that we do, because we're a bit tired of, everybody building a PHC according to what they think a PHC should be, a primary healthcare center, or a general hospital, or a mother and child center. So we're trying to standardize the blueprint. If you want to build a PHC, this is the blueprint developed by the state government.
All right, we'll go on a quick break. Like I said before, we'll be right back after this. All right, welcome back. In case you're just joining us, so we're talking to the Honorable Commissioner for Health, Lagos State, Professor Akin Abayomi. We're talking about the state of health in Lagos and smart health initiative. Before we went on that break, we're talking about people living with disability. You were talking about the blueprint of how primary health care centers have been built currently in the state. Can you just continue on that line of thought?
So what we've had in the past was ad hoc construction, So we want to build a primary health care. It's allocated to a contractor, and the contractor imagines what a PHC should look like. So Mr. Governor is very adamant about the shift. We should have a standard, and he has given us the mandate to develop the blueprints for what a primary healthcare hierarchy of structures should look like, what a secondary, and what the tertiary. So we're busy designing these blueprints, and in these blueprints, we're going to incorporate a lot of new facets. people living with disabilities, one of those, ramps, a design for the auditory impaired, for the visually impaired, for the mentally handicapped, for children. So, and for more increasingly now, older members of society, geriatric population. Yes. So, you can't have, wonky stairs going up in a steep fashion when you've got a 90-year-old person trying to access the clinic. So all these are going to be built in with other facets like low energy, So instead of building a structure that needs air conditioning, why don't you build it in an eco-friendly manner so that it fits in with the environment and it's a low energy consumption facility with the architecture that goes along with that. So these are the new ideas that this government is putting in place, moving forward.
And anything as regards, implementing the laws. So take, for instance, people with disability will still tell you to a large extent that in companies, for instance, there are no rails and the likes,
sure.
Ramps for them to move in.
Sure.
Is that something the Ministry of Health would take very strongly?
Yeah, absolutely. I mean, these are some of the laws are there, and they're not necessarily fully adhered to, but we've started to put a very strong governance structure in place. And during the break, we were talking about that. We may want to go in that direction now. In terms of governance, we've been really operating a health sector without all the governance structures. So if we go to the primary healthcare and the Lagos State Health Management Scheme and the Lagos State Health Infrastructure Accreditation Agencies, we've really been operating without governance. So in the primary healthcare, there's the board, and that is outlined by the federal law, and then under the board is the local government health authority, and under that is the ward health committee. So that's the hierarchy of governance. And without that board, we can't really move forward. So it's in that board that we start to adopt issues around handicap, in the state facilities. And of course, that will spill over into the private sector as well.
I mean, a number of times, the Deputy Governor, Obafemi Hamzat, referred to data as the new currency. And he spoke about how it's important to use the data that we get for planning, as well as, making sure that we do know the number of people in Lagos that do need access to this healthcare. But it's been a bone of contention, for the longest time, we still don't know the exact amount of people that reside in this state. I want to know what the challenges that you face, and because it's important in supporting this health scheme. So how are you going to break that barrier and make sure that we are accountable for the number of people that we have and they can actually get access to this healthcare?
So that's one of the biggest problems that we face. They say about 2,000 people come into Lagos every day.
3,000, actually.
Well, 3,000. Thanks for correcting. It's even worse. 3,000 come in and nobody leaves. So where are those 3,000 going? We've now discovered that they're going into slum areas. So our slum zones are expanding and expanding alarmingly. And that's where we are most concerned about, because that's where we would face a biosecurity threat. An outbreak is more likely to occur in a slum area that has poor housing infrastructure, poor access to water and sewage, prone to flooding, refuse collection, and that's just a breeding ground and a keg of gunpowder about to go off. So how do we keep track of these people? And they're quite mobile, they'll move from one area to another. If we're going to provide healthcare to Lagosians, we must be able to, in some way, capture that data. Are you really a resident of Lagos? Where are you coming from and what are you doing? Where do you live? So in conjunction with our colleagues in LASRA and LASHMA, the Agency for Health Management, we're trying to really pinpoint how we can capture this kind of data. Without data, we really can't plan. And our developmental partners and state and, of course, federal require data. And that data is not just about, how many people are in an environment, but it's also about their profiles. What are they prone to, and what are the kinds of vulnerabilities that they have.
Okay, so let me toe the line of the recently launched SMART scheme. When it comes to e-health anywhere in the world, one issue is that of patient confidentiality. what is the assurance you are giving to Lagosians that, your health data, your health information is safe? That's one. Secondly, according to the World Health Organization, in some Asian and African countries, including Nigeria, 80% of the population depend on traditional medicine. And I know that recently, the Governor of Babajide Sanwo-Olu administration, under your able watch as Commissioner for Health, set up a committee. I think it's the Traditional Medicine Research Committee. What is the objective of this committee, and what's the thinking behind it?
Okay, so you've asked a number of questions there. So let me start with the last. So it's important for us to pay attention to alternative medicine. Most Nigerians and Lagosians will naturally go to a alternative medicine practitioner of whatever variety you wish to call before they present to a government facility or a conventional medicine facility. And we must recognize that, we must appreciate it. So we can't ignore that sector, and it's important we regulate it. So in regulating it, again, one of the 4 governing boards in health that Mr. Governor has approved is the Traditional Medicine Board. Okay. And in line with the federal initiative is that we expand that Traditional Medicine Board to the Traditional Medicine, Complementary, and Alternative Medicine. So it now broadens its scope. So we have things like people that use herbs, people that use acupuncture, acupressure, people that use hypnosis, meditation. And these are all very important facets of healthcare. If you walk into a healthcare facility in India, China, or even in Europe, you can walk into a facility and you'll be asked, what would you like, conventional or alternative? But they're regulated. They have a body, they have a board. And, the first thing that we do as health practitioners is cause no harm. So in you presenting to us for help, our first responsibility to you is not to make the situation worse by complicating it with something. So we have to make sure that what our colleagues in the complementary sector are doing is evidence-based, which was why we launched the research committee associated with the Traditional Medicine Board, to make sure that they have the opportunity to research what they're doing, to publish their data, and to give us as government the confidence that they're doing the right thing. So we're really supporting them. We're setting up parks where they can plant their herbs, where we can restore the eco-biodiversity, because if a herbalist is using natural plants and the ecosystem is being destroyed, where are they going to get their resources from? So Lagos State is paying attention to that, to make sure that in some of our more or less dense areas, where we still have seemingly semblance of forests and natural environments, that we protect those areas and we restore the biodiversity so that our traditional medicine colleagues can have somewhere to restore, like Kew Garden in London, to restore the sovereignty of our biodiversity, which is rapidly being depleted.
And then for the e-health, patient confidentiality?
This is the most important issue. And I want to say clearly to Lagosians that your data belongs to you. The government is just a custodian of your data. We cannot do anything with your data without your permission. And we use it to plan and to define policy, but it is done in such a way under very strict governance and ethics. Data is never sold. It's never given away without your permission, and even when we do, we don't give it away in individual packages. We congregate it and we analyze trends, and it is the trends that is available for us and other stakeholders to use for healthcare planning.
I mean, let me just plow through, the initial point you raised about, traditional healthcare specialists. I mean, and I'll segue this into a conversation about mother and child health, maternal mortality and the likes. You'll see a prevalence of TBA, traditional birth attendants. I mean, they pretty much hold that sector. It is said that a sizable number of pregnant women see TBAs even before they present at the local maternity center. I mean, what's the policy thrust as regards mother and child health? There's a high prevalence of maternal mortality, still in a state like Lagos.
Yes, this is absolutely the point, because we are suffering without a doubt from human resources for health. A lot of our healthcare professionals are moving out to greener pastures. There's a push and there's a pull factor. So the pull factor is, of course, better pay, better facilities, more opportunity to advance themselves. The push factor is basically the hostilities that we face across Nigeria, not just Lagos. So while we're working on those issues, it's not going to stop the brain drain. So we have to look inwards, try and make Lagos more palatable for our healthcare professionals. But, for every one conventional practitioner, there are probably 100 traditional medicine practitioners. Yeah. So how do we complement them? How do we integrate them? If there's a TBA that can assist at a health post, we just need to make sure that we are confident with their abilities. They've gone through some kind of training. They know the limits of their skills, and they don't try and go over and beyond what they're capable of doing, and they still would come under the supervision of a flagship, a comprehensive facility. So if a mother and a child are experiencing some distress, an alert can be raised, and the child and the mother can be escalated to a facility where there's a conventional doctor.
Because the scare is that the TBA still take over the full thrust, and this is less than 10 seconds of the childbearing process.
Sorry?
The TBA still take over the full thrust. They still help get the baby out.
Well, yes. And they've done that for centuries, So, in the environment, a natural birth is fine, but where there's a complication, we need some kind of supervision.
Well, there's a lot to talk about. And wonder if the state is looking to recruit more professionals. That's been a concern of the medical guild in the state, and so many other things to ask. Well, Honorable Commissioner for Health, it's been such an honor to have you in the studio this morning. Thank you so much for coming on the Morning Show here on the Rise. And we wish you the best, because you do have your job cut out for you.